Hello, this is Dr. Brett Taylor. Today's case, we're going to discuss a 52-year-old who presents with 2 years of symptoms after an injury. In my opinion, based on a reasonable degree of medical certainty, the accident resulted in a permanent aggravation of her pre-existing lumbar pathology. 5 years ago, this patient had an L4-5 posterior fusion by another surgeon. On presentation to me with her new problem, she had an abnormal gait and decreased neurologic function, including weakness in her lower extremity. As well, her exam was notable for a positive straight leg raise test on the left lower extremity. Her diagnosis was chronic radiculopathy and failed back syndrome. Her imaging findings revealed multiple abnormalities, including a failed fusion or pseudarthrosis, a bicortical screw at L4, and a lateralized screw at L5. For a multitude of reasons, which go beyond the scope of this presentation, we proceeded first with a posterior surgery to remove the hardware and extend her fusion L3 to S1. This was followed by a delayed staged anterior surgery to place fusion cages at the same levels. After surgery, patients who have this type of surgery during one hospitalization will have physical therapy and occupational therapy daily to make sure they are mobilized. As well, we utilize compression stockings and sequential compressive devices postoperatively to decrease the risk of blood clot formation. In addition, this particular individual had lower extremity venous Dopplers completed prior to discharge, which were negative for deep venous thrombosis. 10 days following discharge from the hospital, this individual experienced unilateral leg swelling and pain with ambulation. She had been compliant utilizing the stockings and the sequential compressive devices. We instructed her to go to a local hospital to have testing of her lower extremities. Her testing was positive for a deep venous thrombosis in her left lower extremity. A deep venous thrombosis after elective spine surgery is very rare, but it is important to keep in your differential after surgery. Risk factors include a history of DVTs, obesity, malignancy, and the use of oral contraceptives. The rate of blood clots after spine surgery is extremely low, approximately 2%. However, the use of compressive devices lowers the overall incidence to 1%. Our patient in this case had an extremely low risk of developing a DVT given her compliance to the mechanical prophylaxis postoperatively. In this case, following the diagnosis, this individual was admitted to the hospital and underwent a mechanical thrombectomy and placed on oral anticoagulation. Her lumbar symptoms and lower extremity symptoms have improved following these procedures, and she remains on oral anticoagulation for the foreseeable future. She will also be evaluated by a hematologist to assess her future risk of DVT. Thank you very much for listening to this presentation. Please contact us if you have any questions.